Andy, again, we appreciate you coming down here this afternoon. Appreciate your patience. You're getting started a few minutes late due to some scheduling foibles. Normally, this is the point in time when I introduce the Asian American group and give you the whole spiel, but you've interviewed with us before, so I can skip that and we can get right into the heart of the matters and the reasons that you're here today. Obviously, you've just spent a term up at Carson City. In addition to the partisan politics, which always play a role in any legislature, in Nevada we also have a north-south tension at times. A lot of it's exemplified by, for example, the medical school potentially at Reno, people wanting to potentially expand into a medical school in Las Vegas to improve health care. We know you're in the medical field. We know this might be an issue that you might have some background in. Using that as kind of a backdrop, what ideas do you have to try and minimize or mitigate that north-south tension, since it is somewhat of a roadblock when it comes to getting a general consensus here in Nevada?
Well, I think, first of all, I was really happy to find that when I got to Carson, there was considerably less of that partisan split than I anticipated. There are a handful of partisan issues, but not a lot. It's a very different place, I'm happy to say, than Washington, D.C. There is a conversation across the aisle. We don't always agree. We don't always agree across party lines. We don't always agree from the Assembly to the Senate. But the conversation is ongoing. And I think there's a lot about the culture that's being fostered up there is changed from recent sessions. That promotes that. I mean, the fact that we don't divide seating on the floor by party is a nice thing. So it gave me a chance while we were waiting for things to get settled. I was sitting next to John Hambrick, who's at the other end of the political spectrum for me, and we got to know each other a little bit. We got to talk about things, and even on issues where we disagreed fundamentally, we were able to have the conversation and understand that our disagreement was one of conscience, that it wasn't partisan. The North-South thing is something I'm intimately familiar with. For one, I was born and raised here, so I've sort of recognized that my whole life. I was previously a faculty member at the University of Nevada School of Medicine here in Las Vegas. So I was a medical school faculty in Southern Nevada for a school that was structurally part of UNR. So we saw that North-South divide up close. And certainly, if you'd like to talk about the medical school stuff more, I've been in medical education my whole career. I do have considerable background on that, but really to get to the issue of North-South, the way that we get around that, frankly, is to be bigger than that. And to recognize that it's not a zero-sum game. We can't play that anymore. That in order for Southern Nevada to thrive, that Northern Nevada, where the rurals have to suffer, there are ways to do things so that it benefits everyone. And one of the things that I've been working on extensively in the interim, in fact, we have another meeting tomorrow in preparation for a presentation to the Governor's Council on behavioral health and wellness on Wednesday, is mental health. And one of the issues that we're pushing, really what this meeting tomorrow and on Wednesday is about, is moving from a state mental health system to a regionalized system. There are currently 3 states that manage mental health services at the state level, only 3. And it doesn't work. Certainly doesn't work for a state like Nevada that has very different areas, very different needs for the different populations, very different resources available. And so we are pushing a plan that will begin to separate that so that we'll move toward regions, perhaps 3 regions, perhaps a southern region, a northern region, and a rural region. And that southern region, what we've been talking about is Clark, Nye, and Lincoln together, because that catchment area is really where people seek their services here in the Las Vegas area. But doing that is not simply designed to get Southern Nevada out of Carson City's control when it comes to mental health. It's allowing each of the regions to determine what their priorities are. I think that, frankly, the folks in Washoe, Carson, Douglas, they are better positioned to identify what their needs are, what resources they have, and therefore what their priorities are for development than we are to talk about what they need there. So this regionalization certainly is good for Southern Nevada, but I think it's going to be good for the entire state. And I think looking for those kinds of solutions to the challenges we face is the real answer. And it does require just being bigger than the north-south divide.
What do you think is the biggest dysfunctional aspect of the legislature, just from your time up there, and what ideas do you have to kind of maybe get around that? Because most people honestly think it's either partisan or it's north-south, and you're saying those issues aren't as prevalent.
Well, I mean, certainly there's still some institutional inertia with any, large entity like that, complex organization. You're going to see some of that kind of inertia. It takes a lot of effort to change, the prior thinking and the prior approach. I think we're seeing with the demographic change in the legislature, we're starting to see some of that as well. I mean, we are at a point now where 2/3 of the legislators represent at least a portion of Clark County. At least a portion of their district is in Clark County. And so that's changing the thought process. That wasn't the case before. Not only was that number lower, certainly a decade ago or 2 decades ago, but also all of the power within the legislature was concentrated in northern Nevada, and that really drove the agenda. That's changed. That's changed significantly. Obviously, the Assembly Speaker, the Assembly Majority Leader, the Senate Majority Leader, and the Senate Minority Leader this past session were all Southern Nevada legislators. It doesn't mean that we disregard the needs of the North or the rurals, and Senator Smith obviously was the Assistant Majority Leader in the Senate. Mr. Hickey was the Minority Leader in the Assembly, so certainly that it requires all those voices. And again, it goes back to that idea of not thinking about it as a zero-sum game.
We were speaking briefly before we went on air, on camera, about what you're hearing most from your constituents and knocking on doors. The biggest issue most people have is that of education. What ideas do you have, perhaps more short-term rather than long-term, to try and mitigate the fact that we are now 47th, 50th, 51st, if you count Puerto Rico, depending upon which metric you use?
Well, as I had said to you before, we'll say it on the recording now, money alone is not the solution, but a lack of money is part of the problem. And I think what's important is that we need to, I think 2 thought processes are essential. First is the recognition that the dollars that go to education are not simply expenditures. They are investments. And we need to think about them in terms of investments and the return that we get on those investments. And the tremendous return, and it is enormous, is a long-term return. But there are some shorter-term payback of that investment. One of the things that we're seeing already, for example, the Zoom schools, where we concentrated some dollars on early intervention with English language learners. And we're seeing some very positive results in just a single school year. And what that means is that we will have to expend fewer dollars on those students for remediation of their English skills and other learning skills, because if you're not at grade level by grade 3, then you're falling behind in every subject. And so the investment in those students early on in the process allows us to save those dollars, not very far down the road, but certainly a savings. So I think that that's one piece of it, is thinking about the investment and the return on investment. The other part that I think is important is that we need to look at both sides of the equation, and I don't believe that anything is off the table. There are no sacred, there are no sacred expenditures. There are no sacred revenue sources. All of it needs to be considered. And one of the things that Superintendent Skorkowski said is he talked about the Pledge of Achievement that the school district is putting into place, is that he intends to look at every line item in the CCSD budget with that in mind. Are we getting a benefit for what we're paying? And if we are, that's great. We should be doing that. If we're not, we need to find a different way to approach whatever that particular problem, whatever that program is supposed to address. So if we can go down that whole list and say, are we doing the best we can with the dollars that we have, at the same time that we're looking at how do we generate the revenue that we need I think we'll get to a better place. You can't just look at one side of it. It's not simply a matter of let's raise more money and put more money there if we're not spending it wisely, but it's also not just a matter of cut the expenditures, because you need to make those investments. If you don't invest in those programs, then you're not going to get any of the return that you might hope for. So that's a little shy, I think, of a really concrete, here's what we're going to do plan. But I think that would be kind of arrogant on my part to say, well, this is what fixes the problem. I mean, we've created this problem over decades, and we need to take the time to look through every single step of the process to figure out where we can do better. And I think there are tremendous opportunities to do that, but that willingness has to be there.
I have a question.
Yes.
Have you tapped the private sector for the lack of funding that you have? Has anybody done that as far as education is concerned?
Well,
And
certainly.
you're looking at federal dollars and state dollars, right?
Right.
That is funding the educational system. Has there been a move to tap the private sector?
Well, there are a number of places where that happens. Certainly, one of the direct connection with the private sector has to do with how we levy taxes on the private sector in order to generate dollars for public education. But if you're looking at the education issue in general, not just public education, absolutely the private sector has a role with private schools, with charter schools that have come online, and looking at ways that we can support the development of those kinds of programs. For one, so that there are options for families to look around at what works best for them, but also so that you can have sort of these living laboratories in which to innovate. That's one of the things that I think charter schools do well, is to innovate. And I think that there is a role for the private sector there. Now, let me be clear, I don't think that the solution to a failing school is to take the resources away. And so when we talk about things like vouchers, I don't have an issue with if a family chooses for their child to go to another educational option, that there be dollars that go with that. But if they're taking them from a school that's struggling, pulling resources away from that school is not going to make that school better. And so there is a limitation to how much we can look at this as a competition issue. I hear that argument a lot, that competition among schools is a good thing. But when you have a competition, there is inherently someone who loses. And I'm not ready to give up on any of our students, no matter what school they attend. I think that the solution is to make all of the schools better. So I think having those options, many of which are driven by private entities, is a great way to push things forward, to make things better. But I don't want to strangle schools that are struggling in order to make that happen.
Is it true that the charter school have less, say, regulation compared to public school, or they can do more?
I think it's really more a matter of them being a little more nimble, because the structure is more localized. And I think there are advantages and disadvantages to that. There are advantages in that they can try things with a little more ease. The disadvantage of that is that they don't have the benefit of large numbers when they assess the outcomes of those efforts. And so we have to recognize that we're dealing with small populations and perhaps particularly select populations before we can generalize the benefit of those practices to a larger population. So there's a plus and minus to that, and that's why I think it's part of the solution. It doesn't answer all of the problems, but it does give us another place to look at how we can do things differently that may be better.
So charter schools start to spring out is because parents are pulling their kids away because our public school is failing, and that's an alternative there, and so they are pulling the dollars to that school instead.
Well, I think sometimes that's the case, and in the concept of school vouchers, that's exactly it. Is that the dollars would go with that child to another place. The problem is that leaves the school that was struggling, that they were concerned about, with fewer resources to fix the problems that they have.
They got less money.
And absolutely. And if you're talking about competing businesses, and the outcome is, well, this business then fails, that's something that we sort of accept. And I think should. I'm not opposed to that in the business sense. But when you're talking about schools, the people who suffer as a consequence of that are the students who are still at that school. And I don't think that we should give up on those students.
So if the way that I look at it, that is sort of like a segregation, would I be right on that?
Well, I'm not sure it's that. That to me implies something that is imposed on the population.
Because if my kid does better, I want them to go to that school. Everybody does the same. And we got a whole bunch of dumb kids left that in public schools, supposedly.
Well, I think that again, the challenge there is how do we raise the level of all the schools?
Right.
We don't do it by taking resources away from schools that are currently struggling. And I will say, as a graduate of Clark County Public Schools, I went to school here, public school here, kindergarten through 12. I think that the diversity that I was exposed to in public school was a great benefit to me.
Charters are private, right?
Well, there are public charter schools, and that's another part of the issue is that we've conflated three very different kinds of institutions when we talk about charter schools. There are public charter schools that are overseen by the State Public Charter School Authority. There are private nonprofit charter schools, and there are private for-profit charter schools. And those are three very different entities. They function differently. Their driving forces are different, and we have tended to treat them the same way. So we had, for example, an issue come up last session that discussed the use of existing public school property to be handed over to charter schools. And if you think about a charter school, the image of a private for-profit charter school, I don't particularly like that idea. You're basically handing public property over to a private for-profit entity. But that's a different thing if you're talking about a public charter school that's administered by the State Public Charter School Administration. So I think one of the things that we need to do as we move forward and discuss these different pathways for education, for K-12 education in particular, is to recognize that nuance, that these are different entities. And that's a different thing entirely, by the way, from a private school, like a parochial school.
So they're supposed to live, well, definition of public school. You're supposed to go to the area that's designated to you, rather than go elsewhere, which extra costs of transportation, time, etc. But now they start going. I know family that go to magnet school. They drove all the way. The kid take bus for over an hour.
Right.
Just
And
to
the
get to
magnet
that.
schools are a whole other
And now
process.
that's a separate.
Right.
Who came up with this genius idea?
Well,
That's spread the dollars
for
so
me,
thin.
the idea would be that every school
Is equal.
would be essentially a magnet school for everything. I mean, we shouldn't say only the kids who go to this one school are going to get the best possible preparation in the sciences, or over here the best possible preparation in the humanities. That should be across the board. I think what the magnet schools themselves provide an opportunity to do is to do that innovation. How do we do this better? But it shouldn't be that if we find at Rancho High School, for example, a way to deliver chemistry education for high school sophomores that is really good, it's really effective, better than sort of what we've been doing traditionally. I don't think that we should restrict that to that school. That should be a model that's then shared across
Absolutely.
the district.
Absolutely.
I think that's the opportunity there. The problem that we're dealing with right now is that all of the schools are struggling just to get by, just to do the bare minimum of what they have to do, because we haven't been making the investment in the future of those schools.
Are the teachers are overburdened by all the things that they have to fill out, write out to qualify for the school itself?
Well, I think
That's what I've been hearing.
Probably the bigger issue has to do with class size. And when we talk about the burden on teachers, we've tried to make some steps toward class size reduction. Class size reduction costs money, but that's certainly been a bigger deal. We've had some success there, but we've got a long way yet to go. But the other big burden on teachers, I think, on classroom teachers, and this is what I'm saying is what I'm hearing from them, is that we spend so much time on standardized assessments that it takes away from instructional time. It really starts to eat into that instructional time.
My son goes to first grade. They have so many teacher conference and no school today. No school.
Teacher
Yeah.
Institute days.
Yeah, teacher do this and that. They go to
when
meeting.
my son, my younger son, who was
So
about
many.
to start his sophomore year, when 2 years ago when we got his schedule for 8th grade, I went through and counted up, and it was approximately 1 out of every 6 school days was occupied with some kind of standardized assessment.
That's nuts.
And I just, it seems so wasteful of time
Absolutely.
and consequently of resources. We can do better than this, but it's going to take some time for us to make that change.
Can I?
Real quick. Last questions we have.
Just shifting from education to healthcare,
Yes.
being a healthcare worker,
Mm-hmm.
you know, my question is about the Affordable Care Act.
Mm-hmm.
You know, it's passed by Democratic Congress, you are Democrat.
Mm-hmm.
Last Friday, I was at the First Med in celebration of the Wellness Week. Dina Titus was there, was a speaker. You know, it's an informal thing and everything. And I asked the worker there on how they view the Affordable Care Act, and it seemed like everybody's happy there. I mean, they have positive, you know, outcome of the, you know, like they said that last month they have 60 new patients from Medicare and uninsured. I just want to know how you feel being a physician. You talk to different people, the different physicians, they say different things. The public says different things, it's not good, it's good, whatever. No. I mean, being a physician, I'm sure you will be your first thing as a physician, first being a, you know.
Absolutely.
What is your take on the Affordable Care Act?
Well, I think there's a few things. First, we need to separate the Affordable Care Act in its entirety from the health insurance exchange.
Okay.
The exchange has been implemented incredibly badly. It has been an unmitigated mess, and it's getting cleaned up, but it's inexcusable that it was as sloppy as it was, and I will make no excuses for that. Now, the concept of the exchange, I think, is sound, and the Affordable Care Act in general, including the healthcare exchange opportunity, is an important step. It is by no means the solution to everything that ails the healthcare system in the United States, but it is absolutely an important step. If anybody perceives it as the solution to the problem, they're kidding themselves. But the idea of ensuring that even more of our population, far more of our population, have access, not just access to health care, but access to preventive care, to health maintenance, chronic disease management. Those kinds of things are incredibly important. And I'm not just saying that because I'm a warm and fuzzy guy and I want everybody to have access to health care and be happy, although I do. But it's economically the smart thing to do. It is far less expensive to keep someone healthy than it is to wait till they're sick. It's also far more effective to keep someone healthy than it is to wait till they're sick and try and treat them. And the other thing is that people who are healthy can be productive. People who are sick are not productive. They don't contribute. So purely from an economic standpoint, it's a smart thing to improve access to primary and preventive health services and chronic disease management than to have people who don't have that access and wait until they're very sick and then end up in the emergency department. And emergency departments are great, but they are the most expensive and least effective way to deliver health care. And so driving away from that toward a more preventive, more health maintenance focused sort of system is a great move. There's a tremendous amount more that we need to do. This is not the end of the reform of the delivery of health care in this country. It can't be. There's much more that we need to do, but it is an important step.
Yeah, there's no perfect health law. But separating that from the exchange, would you say that Affordable Care Act, because, I mean, the Republicans are trying to repeal it,
Right.
right? To me, why repeal it? This is the first time we have a health care law.
Well, I'm not sure which.
Instead of repealing it, why not?
Right. I'm not sure which part they don't like and that they want to repeal.
Well, it seems like this, from what I heard, it's like, I mean, repealing it totally. To me, why repeal totally? Why not?
I don't see why we would want to reinstate lifetime caps, why we want to reinstate pre-existing condition exclusions, why we would want to eliminate the opportunity to keep your kids on your health insurance until they're out of college and have a job themselves.
Yeah.
I don't see the downsides of those things. So are there things that we can do better than what's currently in the law because it either wasn't affected by the Affordable Care Act or we can do a little bit better than that? Yes, that's where the conversation should be.
Right.
How do we make it better from where we currently are, not how do we roll back to where we were?
Right. Instead of totally repealing the health law, why not work on it and go from there?
Remember, Andy's not a Republican in Congress
It-
yet.
No.
Put that out there.
I'm quite
You know.
confident I'll never be a Republican in Congress, but I'm not looking for
Yeah.
Congress right now.
Yeah.
I like being at the state
My-
assembly
yeah.
where I can
Last
actually get some work
question.
done.
Okay, we're already well above the 20 minutes. We have someone waiting.
How's it
Make it quick. You never do, but I'll give you a chance.
Can you enlighten me on the healthcare exchange? To my understanding right now, yes, they did terribly, but what's the relationship between our government and the insurance company? They work together on that, or are there intentional sabotage in there? That's why it's a mess.
Wow, that's a quick one.
Your take.
There is.
30 seconds.
I am not aware of any intentional sabotage. I will say that with absolute clarity. And
Okay.
it would deeply distress me if that were the case. I'm oddly enough, I'm hoping that this is just a matter of incompetence because the alternative is such a horrible thing that this was intentional. That being said, what matters to me now is how do we get it fixed? And I was actually with some folks at Health Plan Nevada the other day saying to them, how are we doing now? Are we still having these problems where people are enrolling and their information is not getting to you? And the answer I got from them is, we're at the point now where it's an occasional issue. It's still a problem, but it's an occasional issue. It's not a wholesale kind of a problem where we're having dozens or scores of people who are signing up and their information is not getting transmitted to the health plan, and therefore they're not having coverage. But there was just another article in the Review Journal this week about a woman who's been waiting 8 months that she signed up and the health plan doesn't